Vaccinations are really important during pregnancy. It's something that we really want to prioritise for our pregnant population. So this year at CDDFT we are offering 4 vaccinations: COVID and flu, and then whoop and cough and RSV, which is new for this year. Vaccines are the best way that you can protect yourself and protect your baby from preventable illness, so something that's really important to consider. So in early pregnancy we offer 2 vaccinations, flu and COVID. The earlier we can give those before that winter season, the better. Many women won't consider that flu vaccine as particularly important in pregnancy because if they're generally fit and well, it's not something you think about. However, people can become really unwell from flu, and it's not always those groups that we might associate with being unwell. So during pregnancy there are physiological changes that occur to mum's body that mean if they do get flu they can become more acutely unwell. For example, some women need intensive care admission. There's an association with preterm delivery and a smaller baby. However, if ladies have the flu vaccine, it can offer protection to babies for 6 months postnatally as well, so really important. COVID-19 we've all heard of. Again, it's a seasonal vaccine and we offer that during the autumn-winter season. We then reassess to see whether the offer will continue into the spring season. Research from previous strains and waves, we've now got the benefit of that, and we know that COVID can increase risk of miscarriage in ladies by up to 25%, and it can also increase the risk of babies needing special care admission 5-fold. So again, something that's really important to consider when we've got the benefit of that vaccination. So whoop and cough, or the pertussis vaccine, is something that we offer to our pregnant population from them being 16 weeks pregnant. Again, very important because although most people would have common sort of respiratory symptoms, cough, bit of chestiness, for others it can be really quite serious and can cause pneumonia and difficulty to oxygenate, particularly for younger babies who are more vulnerable. Unfortunately, there have been 9 child deaths between sort of winter season 23 and now, so it's something that is still prevalent within the population. The good thing is we know that the pertussis vaccine is 90% effective against children developing severe illness when they're less than 3 months of age, which is really beneficial because children don't get their own vaccines until they start that vaccine schedule, sort of 8, 12 and 16 weeks. So it covers them for that period of time, which is really important. And then RSV is another respiratory illness. It's new to this season, so it's something new and exciting that we can offer our pregnant population to keep them safe. 90% of children aged under 2 will get RSV. Again, would be a normal viral infection for most, wouldn't know any different. However, for others it can be really quite serious and caused over 30,000 hospital admissions last year for children. Initially this vaccine was given to the elderly population and to vulnerable children, but really importantly this year it's been approved for administration to pregnant women with the aim that we get that passive immunity through the placenta to our babies, so that again they're protected within those first few months of life when they're more vulnerable. We all hope that we won't become unwell with any of these respiratory infections, and that if we do it will be really quite minor. However, unfortunately people do become unwell, and children, particularly when they're younger and more vulnerable to picking up bugs, become more unwell too. We're really lucky to have the science and the vaccine availability, so we need to use it. The simplest thing that our mums can do to protect themselves and their babies